Hey guys, I'm Kayla Taylor and welcome to Kayla Tailored Wellness. I am a family nurse practitioner that specializes in integrative medicine. So what that means is that not only do I get to take care of patients traditionally in the healthcare clinic, but I also get to educate on lifestyle changes, health promotion, and customized health treatments with vitamins, botanicals, and herbs. Today, I want to discuss anxiety and go over what are the signs and symptoms of anxiety, how I would treat it pharmacologically in the clinic, and how you can naturally treat anxiety. But first, smash that like button and hit that subscribe button for the YouTube algorithm. Just remember, I am not your healthcare provider. I do not know your allergies. I don't know your past medical history. I don't know what medications you are taking. So use this information you learned today to have an educated conversation with your healthcare provider. So, back when we were cavemen, we had a response. It was called the fight or flight response when we encountered scary predators such as a saber-toothed tiger. And when we encountered that saber-toothed tiger, our sympathetic nervous system went into activation. And so this is our fight or flight response. We're either going to fight off that tiger or we are going to run. And so now, today, when we're not experiencing these scary predators, we can still have that sympathetic nervous response, and it actually is anxiety, and you're experiencing the sympathetic nervous response in everyday situations. Anxiety creates a feeling of nervousness, apprehension, and worry in everyday situations, so our sympathetic nervous system is activated when it doesn't need to be. So signs of anxiety would be having trouble concentrating, unable to focus, feeling like there's butterflies in your stomach or having a nervous stomach, having trouble falling asleep, or feeling very restless. If a patient comes into the clinic and they want pharmacologic treatment for the anxiety, I would first start with an SSRI, otherwise known as a Selective Serotonin Reuptake Inhibitor. So those increase the serotonin. That way it decreases the response to the anxiety and decreases cortisol, a stress hormone. So examples of an SSRI would be Prozac, Paxil, Zoloft. And so those medications are taken every day to prevent anxiety. And they can take up to 4 to 6 weeks to get to their full therapeutic effect. My favorite medication to use as needed for anxiety would be a medication called Hydroxyzine. So another name for that would be Atarax or Vistarol. So this medication is used as needed when a person feels anxiety. It originally was used as an antihistamine similar to Benadryl, but they found that it had a very calming effect and also helped people sleep. So it's great for people with anxiety who have trouble sleeping at night. Another medication that can be used as needed would be a beta blocker. So an example of that would be propranolol. So originally this medication was used for reducing blood pressure and heart rate, and they found that patients who have a lot of anxiety get this very high heart rate, otherwise known as tachycardia. And the beta blocker will decrease the heart rate and therefore decrease the anxiety. This medication can also be used for people who have stage fright. Another as-needed medication would be benzodiazepines. So these would include Xanax or Ativan. These are controlled substances I don't like to prescribe. They can have risk for abuse. Sometimes people sell these on the black market because they can create a high. They become dependent on these medications and need a higher dose to get the same effect. And they can be very sedating, leading to respiratory depression. My number one lifestyle treatment for anxiety would be exercise. Just getting 30 minutes a day of exercise, trying to get outside, getting some fresh air, even doing yoga can all increase serotonin and reduce that anxiety. My second favorite recommendation for anxiety would be meditation. So I like to do guided meditation through phone apps like Calm or Headspace. So what they do is allow you to focus on your breathing. You can be present in the moment, and it can reduce those racing thoughts. My third recommendation would be diet. So they believe that about 70 to 90% of your serotonin is produced in the gut. So you need to feed it right. Feeding it fast food and sugar is not going to provide the effective nutrition to produce that serotonin. Along with the diet, I would also recommend limiting caffeine and alcohol. So caffeine increases the heart rate and it blocks a chemical in the brain called adenosine, which has a calming effect. My next recommendation would be therapy using CBT, which is cognitive behavioral therapy, and biofeedback. You can understand why you're having this anxiety and come up with coping mechanisms to deal with the anxiety in the future. So sometimes when I have patients come into the clinic and they're very anxious, I can start feeling a little anxious. And so I try to do a breathing technique with them to help decrease the anxiety so we can focus on the problem. So it's called the 4-7-8 breathing technique. So what you do is you breathe in for 4 seconds. You then hold it for 7 seconds. And then you breathe out for 8 seconds. And this is going to help lower that heart rate naturally. So the essential oil lavender has been studied to reduce anxiety and help you rest. So you could spray a little lavender essential oil on your pillows before bed, and that should help with relaxation. Most importantly, limit the stress in your life. If it's a person, then you're going to need to limit them. If you're overscheduled, cut back on things that you're committed to. That way, less stress creates less anxiety. So just like I discussed, eating healthy foods for your gut, another way to support a healthy gut is taking a daily probiotic. And that way your gut will be able to produce the serotonin your brain needs. I would also recommend a B complex. So B6 and folic acid are essential in serotonin production. Another supplement I would recommend is 5-HTP. So you can take 150 to 800 milligrams a day. This is an essential amino acid for serotonin production. So if you have enough 5-HTP, then you're going to increase that serotonin production. My favorite botanical is kava root. So you can take 50 to 70 milligrams a day. Overdosing can lead to liver damage. When I personally use kava is when going to a kava bar. They can take the root and create a tea. It does taste like licking a rock. So you can add flavors to it, and what it does is it can make the mouth feel a little numb, but it can cause a relaxing effect without impairment. Another supplement would be valerian. So you can do 300 to 450 milligrams 3 times a day. It has kind of a calmative, relaxing effect. It can help with sleep. It's known as nature's Valium. So you can mix the valerian with passion flower, 400 to 600 milligrams 3 times a day. So passion flower is used for patients who are burnt out or feeling very restless with their anxiety. It has very minimal effects, but it can help reduce the anxiety when mixed together with the valerian. You can also mix 100 milligrams of St. John's wort with the valerian. So St. John's wort is great for depression, and a lot of times depression and anxiety go along with each other. Just be careful with St. John's wort is that it can have a lot of medication interactions. Chamomile is a great anti-inflammatory and helps reduce anxiety. So you can try some chamomile tea before bed just to help you relax and reduce that anxiety and having that calming effect right before bed. L-theanine is found in black tea, or you can take it as a supplement, 100 milligrams a day. So it helps those with anxiety in stressful situations. It's going to help reduce the stress and decrease that heart rate. So that's all I have today. Please comment below. Let me know if there's anything that has helped your anxiety. Let me know if there's any other health topics you'd like me to address. And you can follow me on Instagram at Kayla Tailored Wellness. And feel free to check out my affiliate link. It has competitive pricing on supplements. And thank you again for watching my video and letting me tailor your wellness.